Well, hello, everybody. I'm Dr. Craig Bax. I'm the Chief Medical Officer and founder of the Cure Center for Chronic Disease in Springfield, Illinois, and also the CEO and founder of Cure Coach Incorporated. Our program is intended to support the measures necessary to identify and cure chronic arterial disease and cardiometabolic disease, including type 2 diabetes. And I'm pleased to be having a conversation today with a good friend and dental colleague, Mark Huberty, who is a dentist I met first at a Bale Donine preceptorship a number of years ago. Our paths have crossed since then at AOSH meetings, and recently he and his staff have started to utilize the butterfly ultrasound probe to see plaque in the carotid arteries of their patients in the dental practice. And so I appreciate the fact that Mark is willing to chat with me today and maybe share some of his experiences and his staff's experience as we've been embarking on this new and innovative journey together. So, Mark, I want to welcome you and thank you for joining me.
Thank you, Craig. I'm glad to be here.
So, I probably twisted your arm several times in talking about this. We've had several conversations, but your practice bought a probe about maybe 4 or 5 months ago, if I remember correctly, and they've been playing with it. We've been doing some training through Zoom, and you've been sending some scans, and they've been very useful for interpretation. So congratulations on that. I wonder if you would be so kind as to just share your overall impressions, how you first reacted to this, how it came into your head as to how you would incorporate it, and what the experience has been like so far, the good, the bad, and the ugly.
Certainly. Well, first of all, thank you for partnering up with me. This is an incredibly important mission that really collaboratively ties us all together. So, yeah, our journey really started out, like you said, just being aware. And I think that that's really how this program is going to work. Approaching that same attitude with your patient base, letting them know that this is something of value and they can avail themselves to. We started out having absolutely zero barrier issue for them because we did not charge them anything while we were learning this. Probably 3 to 4 months into doing this, we have not charged them. We said, would you be interested? After going over the benefits, they found the value of that very without any hesitation, and it's been very successful with a launch like that. It allowed us to do our training without a lot of pressure on the two gals in our office that were trained by you, Craig, and a little bit by myself. And until they got comfortable, confident, let's say perhaps maybe a dozen or so times, they went from being all fingers and thumbs and to being very skilled at capturing certainly the cross-sectional and now just most recently longitudinal. So the good part is that we're there. Maybe the bad part is it took us so long. The ugly part is that we should have done it a lot earlier.
Well, I appreciate that. It like anything new. I think the only thing that likes change is a wet baby. So anything new like this is it's going to be first be misunderstood, and then go through all the stages of grief. And so, but I think what I guess my own journey with it was just seeing is believing. When you see that you have a problem, it's a lot more convincing and more motivating. And then when you learn that there is an opportunity to address it, and that part of the solution is right there in the office of the medical dental professional where you're sitting, because we know that oral health issues impact cardiovascular and metabolic health, and that we should be working together. So I think coming together around this imaging mostly to motivate patients to start looking at root causes and engaging with a medical partner. I think it's not moving as quickly as certainly I would like to have worked or have it move, but we're getting there. And I think maybe it is better that we're going slowly and getting it right.
Absolutely. And I think that the clear benefit of this particular collaboration, outside of the obvious benefit to the patient, is that we see all our patients on average twice a year, which is quite a bit more than the medical profession sees.
Mhm.
And because there is disease bidirectionally between our two offices that we both have to deal with, it's very comfortable to operate back and forth. The patients as well understand that it's a very good handoff. So there's a high level of trust when they go to you. I think we probably have 100% conversion on that, which I think is a testimony to that overlap, but also the value to our patients. So I think the sky's the limit, despite the fact that it is a little bit of a slow start. And again, to be fair to both of us, there's really not a model like this. So we're kind of inventing it as we go.
Yeah, we're building the airplane as we're trying to fly it at the same time, which so but one of the things that excites me is that in the beginning, when we started this process, is that it was more or less just strictly a screening ultrasound. Do you or do you not have plaque? Which, by the way, I think the model that we should be thinking of is that this is such a common, ubiquitous problem, especially as we get into our 40s, 50s, and 60s, that really the assumption should be that there is disease present, and everybody should take a look to be, let's see if you don't have it, to be considered guilty until proven innocent. And because until you actually know or can see the problem demonstrated, it's not going to be addressed. But one of the things that I'm excited about is that now that we can move from just simply disease detection to disease measurement using the additional views and having that information processed by Vasal Lab so that we can get a report that tells the patient what type of plaque they have, what their arterial age is, where they stand, and then use that information periodically every 6 to 12 months to see if where the arteries are actually getting thinner, healthier, less inflamed, and dramatically reducing the risk of an event, meaning by an event we mean a stroke, a heart attack, needing a stent or surgery. One of the things I would just point out for the audience is that if we see improvement here, we can infer improvement elsewhere because it is a systemic condition, although there's not a perfect correlation, but that's a conversation for another discussion. What do you see as I guess the reaction of your staff? Have they been hesitant or excited or mixture, or what would you say to any dentist what they would anticipate if they were going to embark on this process in their own office?
Sure. I think like any change, initially there's a bit of a learning curve that they understand what they're really doing. They have to know this is a valuable service to really be able to convince the patient that this is something worthwhile for them to do. They also know these patients for decades, and they want to come at them knowing exactly what they're doing and that it's valuable to them. The good news about that, though, that I think that shortens their learning curve is that they're very, very good with the idea of prevention. If you look at what dentists do, we live in that space. The two most common diseases in the world are caries and periodontal disease. We can get way ahead of that before it causes a problem. It's all about prevention. Even with oral cancers, 9 out of 10 of those are squamous cell. You can get ahead of that before it causes a problem. So they didn't really have to learn that part of it, which could be a barrier. When you look at the medical model, compare the dental, one's more preventative, certainly one's more emergent, where they shine. So I like how this works from their perspective. Their head's already in that space. So I didn't think that fundamentally or philosophically they had a hard time with it. They just had to get the proper training to be comfortable, and they are now, and they have no problem. They're excited to do it, quite frankly.
I think technically speaking, to me, the ultrasound probe itself, which for those that haven't seen it, it's a company called Butterfly Network. I mean, I guess really to me it just looks like a big fat handpiece, if I'm using the right terminology. And so the same skill set that enables them to to do their hygiene protocol and what they do can be easily applied to this. And I think the other thing I would say that it truly elevates the importance of the hygienist and the assistant in the patient's overall health care. I mean, I'm looking forward to the patient who comes back someday, and it probably won't be that long, maybe 6 months to a year, and say to be really grateful for having had the opportunity to find out that they had a serious problem and feel like that the not only are they saving teeth, but they're saving lives.
Without question, that's true. And it's already come back in the short period we've been doing this. We've had very, very grateful patients, because typically when you access a medical establishment, you've already had the event. So this is a rare opportunity, again, to get ahead of it before it happens. And it resonates with people. That's what they want. And I think we all want that, quite frankly. And it's a very low bar for the patient to get it, and it's a low bar for the office to deliver it.
Okay, well, we won't go into a lot of the technical details, but in essence, the way the process works for the audience is Dr. Huberty and his staff have one of these probes. They take the scan of the patient. I would say it takes probably less than 5 minutes to do the actual scanning. For the most part, once there's a certain level of confidence, it gets shorter. They enter the information on it to an interface that is actually on a smartphone or an iPad is commonly used. And then that information, those images get uploaded to a cloud platform that enables me to review the images and provide a screening report. And if the images are suitable, then they are actually sent on to Vasolabs for a more detailed report if that's what the patient has decided they want. And so we're working through a lot of the details of the economics of it, but I think we're very close to having a model that's going to work very well and smoothly for everybody, but for the most of all, to enable patients to have access to something that otherwise, would just be unthought of in the past. And I just really, love working with highly motivated dental professionals, and I think it's going to be kind of a chicken and egg thing. As dentists and hygienists find more patients who need what we do, we're going to be able to convince more and more providers to leave their old reactive model and join us in this newer, more proactive and early intervention model. I mean, one clarification, I think you mentioned prevention. Clearly, yes, that is the optimal tool, but we all know that patients come to us with various different stages of chronic disease, and really what we're doing is intervening as early as possible, much earlier than in your, classically before the tooth is lost, you're trying to intervene in the periodontal disease and the caries that would, so they can save that tooth in their smile. We're intervening in the earlier stages of arterial disease and metabolic disease, like catching them. I mean, it used to be a big deal to catch somebody in the pre-diabetes stage. I want to identify them in the pre-diabetes stage, when it's just insulin resistance, where a lot of damage is being done. So I think we're of the same mindset. We're approaching the problem from slightly different perspectives, but the whole goal is to synergize this for the patient's benefit. And you guys are doing an amazing service by allowing the hands-on aspect of this to be done at the same time that they're getting the other hands-on services for dental hygiene and the dental x-rays. And that then allows the patient to access our medical expertise in a more convenient way, for the most part, by telemedicine, by Zoom, eliminating the travel barriers and the costs associated with that. So Well, I know you have a very busy schedule. I really appreciate you taking the time. I want to thank you and Heidi and the rest of your staff for embarking on this journey with us, and I'm really looking forward to saving as many lives as possible.
Absolutely. Thank you. And thank you personally. You're one in a million. It feels like you can't do this without someone like Craig, and there's very few people out there like him. So thank you.
Well, we want a whole bunch more to join us, so we aren't so lonely, right?
We like company.
But there's plenty of work for everybody. We don't need to be worrying
Question.
about you know, in fact, we need more minds and thought, more people bringing their experience and ideas to the table. So I hope this convinces many more to join us. Well, thanks very much, Mark. You have a
I
great
think
evening.
you as well. Thank you.